Hello everyone, this is Professor Fabry again with my favorite patient, Becky Watermelon, who just left her arm for us today. Today I'm going to be showing you how to do the Venipuncture SSP. The first thing you always do whenever there's a nursing intervention that needs to be carried out is you check to make sure you have a valid physician's order. So I checked the chart and the doctor wants Becky to have a PT INR drawn. That's a special blood test for when patients are on Coumadin, so we can gauge how much more Coumadin they might need or if they need less Coumadin. So first, I'm going to go in and make sure I have all my supplies. I walk into Becky's room, I introduce myself, and I explain to Becky what I'm going to do. I want to make sure that I have the right patient, so I'm going to be checking 2 patient identifiers. I know I have Becky and I have her birth date, so I know I have the right patient because I compared it to the order. Now I'm going to get all my supplies ready. The first thing we're going to need is a tourniquet, a Band-Aid, and a 2x2 to put on the site after drying it, my alcohol swabs to clean the site for 30 seconds. This is a tube for a PT INR. You might be asked to draw a CBC, a complete blood count, or a BMP, basic metabolic profile. Those are different tubes and you need to learn those different tests and what they're for. And then finally, my vacuum container with the needle that's already on there. So first I'm going to ask Becky, have you had any surgery like a mastectomy? Did you have an AV fistula put in for dialysis? Is there an arm that you prefer or you don't want me to draw? Becky hasn't had any of these issues, so it's okay to use her right arm, which is what I'm going to be using. So I'm going to look at the arm. Before I do that, of course, I wash my hands thoroughly with my alcohol rub. So I'm looking at Becky's arm to decide where I should tie the tourniquet. We usually use the antecubital area. Here's my tourniquet. You want to tie it in a quick release knot so that you can take it out. You want it to be pretty tight. So I'm looking at Becky's arm and I see a nice vein right here. So now I'm going to untie the tourniquet and I'm going to clean my site. I'm going to wash my hands again. Make sure that they're dry. Put on my gloves if I can. I remember where the site was, and for 30 seconds I'm going to clean this site. The reason I don't have the tourniquet on all this time is because it's too long to keep a tourniquet on. That can be very painful for the patient. You want to go from the inside out. I'm going to leave my little alcohol there so I remember. Now I'm going to tie. Before I tie the tourniquet, I'm going to get my things ready. I'm sorry. I'm going to open up my 2x2 so I'm all ready to go. See, you have to think through these things sometimes. Okay, my vacuum container and needle are all ready to go. Now I'm going to tie my tourniquet on. So notice, this is the vacuum container, this is the needle, this is the safety on the needle. And I also want to have my tube ready that I put inside the vacuum container. I have cleaned the site. I want to make sure the bevel of the needle is up, and it is. I'm going to tell Becky, you're going to feel a little pinprick. Don't prolong the agony. Go in quickly. And then you press the tube into the vacuum container needle. When it's 3/4 full, you're going to remove the tourniquet. Sometimes the blood in this arm doesn't come out all the way. So I'm going to pretend it's 3/4 full. Remove my tourniquet. Take the tube out of the suction part of the needle. Take your little 2x2, pull it out. Right away you put the safety on. Always dispose of it immediately. Becky, are you okay? Was that all right? Oh good, I'm glad it didn't hurt too much. Apply some pressure to the site. And then you apply your Band-Aid. Check the site. I don't see any bruising or anything. I got my Band-Aid on. The last thing you do is always label the tube at the bedside, because if the tubes get mixed up, if you just put them in your pocket, you forget which patient you did this on. So the blood is all ready to go. I check with Becky, make sure she's all right. Now the last thing I'm going to do is label the tube right at the bedside with Becky's name, her date of birth, the medical record number, today's date and time, and my initials, because I'm the one that drew it. So then we're going to label that, put it right on the tube. Then the tube goes in this special biohazard bag. Sure it's sealed, and it goes up to the lab, or down to the lab. And either the aide takes it or you take it for the patient. So Becky, is there anything else I can do for you? I have your call light within reach. I have 2 side rails up. I have your phone next to you in case you need it on your tray table. I look around the room, make sure everything looks safe, and I say, Becky, I'll be back in about an hour to check you. Thank you.